Hey friends, so the skill that we're going to cover right now is assist to feed a client who cannot feed self. One of the most important things with this skill is that you pick up the meal card from the tray and that you have the resident verify their full name. Because again, you have to make sure that you are feeding the appropriate type of diet for that client. You also have to make sure that they have their food tray visible. They need to be able to see what they're having for lunch that day. You want to make sure that you offer a clothing protector, and they have the right to decline it if they don't like it. Also, you have to clean their hands before you begin to feed the client. When you're feeding the client, you have to let them know what all is on their food tray and also what beverage they have for that day. When you begin to feed, you have to ask them what they would like to eat first. You can offer 2 bites of food, and you must offer at least 1 beverage throughout the meal. When they are done, they will let you know. You will then move the tray out of the way and continue with your skill. Make sure that when they're done, you wipe their mouth and you wipe their hands. Remember, this is a social event, so it'll be nice to have some interaction with the resident. Okay, let's get started.
Come in.
Good afternoon, Mrs. Smith. How are you doing today?
I'm good. How are you?
I'm doing well, thank you. So I'm here to feed you lunch. Is right now a good time?
Yes.
Okay, give me just one moment, ma'am. Okay, can I have you verify your full name, please?
Charlie Smith.
Okay, great. That is your lunch. Okay, so let's go ahead and get us a little bit of privacy. Now, Mrs. Smith, because we are going to feed you, I have to make sure that you're sitting upright. We want to eliminate any aspiration or choking. Is that comfortable for you?
Yes.
Okay, let me go ahead and make sure that the bed is at the lowest position and also that your brakes are on. Okay, ma'am, let me get your food. Okay, Mrs. Smith, so I have your food here. Now, I do have a clothing protector. Would you like to wear this?
Yes.
Okay, great. Let me go ahead and want to make sure you keep your dress nice and clean today. Does that feel okay?
Yes.
All right. Okay, Mrs. Smith, I do need to wipe your hands. We're going to move your call light just to the side. Okay, and I'll take this one. Okay, Mrs. Smith, can you see your food right there?
I can.
Okay. All right, well, everything looks good here on this tray. So what you have today is you have spaghetti, carrots, peas, apples, and for a drink you have milk. Everything looks amazing. What would you like to eat first, ma'am?
We'll do spaghetti.
Okay. Does that taste good?
Yes.
Okay. Are you ready for your next bite?
Yes.
Okay, what would you like to eat next, Mrs. Smith?
We'll do peas.
Okay. Does that taste good?
Yes.
Okay, good. All right, so would you like to have some of your milk?
Yes, please.
Okay. How did that taste?
Tasted really good.
Yeah, and everything smells so good too. What else would you like to eat next, ma'am?
I'm okay.
You're done?
Yes.
Okay, great. Let me move this out of the way. Okay, ma'am, I'm going to go ahead and wipe your mouth. Did you enjoy your lunch?
I did.
Okay. Okay, ma'am, can I have your hand to wipe it, please? And I'll go ahead and wipe this one. Okay. Now, Mrs. Smith, I'm going to leave you sitting upright for about 30 minutes. It's going to help with digestion, and it could also help eliminate aspiration or choking. Okay, do you need anything else?
I do not.
Okay, great. I'm going to go ahead and move this out of the way. Okay, Mrs. Smith, are you nice and full? Your lunch looked delicious. Okay, so what I'm going to do now is I'm going to go ahead and again leave you sitting up, but I'm just going to check that your bed is at the lowest position. I also want to make sure that your brakes are still on. Okay, Mrs. Smith, here's your call light. Please call me if you need anything, okay? You have a great day.
You as well.
Thank you. I'm going to go ahead and remove privacy. I am now washing my hands. My skill is complete.